Cancer patients don't just deal with the challenges of treatment, they also face various skincare concerns. Now, to help understand how to care for the skin during and after cancer treatment is dermatologist Dr. Marie Reyes Habito. She now joins us live via Zoom from Laguna. It's a beautiful day, Doc Claire. Good morning.
Good morning, everyone.
So, Doc Claire, when people think of chemotherapy, the first thing that comes to mind is normally the hair comes off, right? And I don't think most people know that it also affects the skin. So can you tell our viewers, how does cancer treatments like chemotherapy affect the skin?
Yes, so I'm so happy to be here and trying to encourage more patients to take care of their skin. You see, chemotherapy tries to stop cancer cells or multiplying cells, but since the skin is also multiplying, the skin tends to delay its repair, or it tends to delay its multiplication. Hence, it becomes drier. And you know, there are new medicines now for cancer. We call them targeted therapies and immunotherapies. These are very good treatments. But at the same time, they have very severe skin side effects. Patients have rashes, sometimes acne. But you know, when these rashes happen, it means that the medicine is also working very well. So that's where I come in. I want to encourage people to try to take care of their skin and at the same time see a dermatologist whenever rashes are seen.
Doc, what are the most common skin issues, aside from the rashes that you mentioned, that the cancer patients face during the entire treatment?
Well, the most common really is the hair loss, and people really feel devastated when they see their hair falling out. But another is what you call toxic erythema of chemotherapy. You see, chemotherapy comes out of the sweat glands. And when they come out of the sweat, the most common area where the sweat glands are in the hands and in the feet. Other areas will be your groin and your axilla. And these are the areas when the chemotherapy comes out, it causes some redness, rashes, and we call it actually hand and foot syndrome. Patients would have cracking on their hands, cracking on their feet. So if you're on chemotherapy, I encourage you not to use your hands like slamming it. Example, working in the kitchen or cleaning. And when you have your walking around, don't stomp your feet, don't use hard footwear, because that can worsen the side effects of the chemotherapy.
Well, there's some people, you mentioned the cracking of the hands, you mentioned the rashes. Some people, when they're not going through chemotherapy, when they're not going through any cancer treatment, they already have certain solutions for them. How different are the solutions that cancer patients need to take to address these particular side effects?
Like different tips. Example for the hands and feet. When you're undergoing chemotherapy, you can actually use a hand. In it's called ice pack or cryotherapy. Like when you hold on to ice and even cold object, there's vasoconstriction or decrease in blood flow in the hands and the feet. So the chemotherapy will not pass through the hands and the feet too much. That will lessen the side effect actually of the hand and foot syndrome. So hindi masyado mapula. In fact, yung mga nails na nahuhulog or nangingitim, that will also lessen if you have that parang ice pack technique.
Now, Doc, are there any specific ingredients that the cancer patient should avoid when they buy skincare?
Yeah, good question. So I promote especially patients who have breast cancer. I try to promote paraben-free, phthalate-free skincare products. It's because these ingredients, these are, example, parabens are actually preservatives that try to prolong the shelf life of your cosmetics. However, they are known to be xenoestradiols, which means they mimic estrogen. And if they do so, they have a hormonal effect. So for breast cancer patients, that's what I say. And studies have shown actually that, like there was a study on certain number of people, like 30 people who did not use any parabens and phthalates in their skin products. And later they found out that after doing so in a month, their urine and blood parabens were actually decreased. And even their gene or oncogene expression has decreased. for those patients.
Doc, you mentioned that one of the effects of the chemotherapy or any cancer treatment is the hair falling off, right? Are there specific scalp care products or shampoos that you recommend to these cancer patients?
Since your scalp is very thinned out already, you don't need a lot of bubbling. Now, the bubbling is caused by a ingredient called sulfates or sodium lauryl sulfate. So usually for patients who are thinning scalp, I recommend an SLS-free shampoo. And um, it's actually good to have your hair cut already if you're on the later side of the chemotherapy so that you don't really see lots of hair falling down. Um, Putting on some oil on your scalp will also help decrease the dryness over the scalp area as they thin out.
When we talk about the skincare, a lot of people, even without cancer, people think about the reaction of the skin to the sun. Now, if you're going through cancer treatment, I'm sure that changes quite a bit as well. So, what approaches should they take when regard to skincare, especially with sun exposure, given the different types of treatment and, of course, the cancer itself?
True. Nowadays it's so hot. I have a friend who just exposed herself washing her car and she had a sunburn
Ooh.
in 30 minutes. So exposing yourself to the sun would cause sunburns. If you are a cancer patient on chemo, your skin repair is a lot slower. And for patients who are, let's say, on radiation, um, we have this what we call radiation skin recall, that if you expose yourself to the sun, the dermatitis appears even years after tapos na yung radiation, pero years after you expose yourself to the sun once more and get a sunburn, the area where you had the radiation will have a severe dermatitis once again.
Yeah, so you take a look at a lot of people would actually try to use sunscreen, will try to use, will actually say that, oh, this SPF is enough,
Yeah.
and look at the different measures of trying to protect themselves against the sun. If you're a cancer patient in particular, is there a prescribed, I guess, ingredient that you have to avoid? And of course, is the SPF count different necessarily for those with a bit more sensitive skin because of their treatment?
I usually give the SPF 50, at least that one. And then as you go through the increments increase kasi SPF 80, 100, maliit na lang yung significant add-on to that. But I also tell patients that the mineral sunscreens will be better. This is where you have the zinc oxide, titanium dioxide. Yung medyo mas maputi on the side. But those are physical sunscreens. So they have a way of protecting the skin from the UV light also better, and lesser rashes compared to chemotherapy, chemo type of chemical sunscreens.
Now, Doc, we mentioned about the sulfate-free hair shampoo, the SPF, and the paraben-free. So those are the stuff that we put on our skin. Now, but what about the stuff that we take? So are there like specific foods or supplements that cancer patients should take during their treatment to help?
Foods rich in antioxidants, so that's your fruits, vegetables. Of course, they're very good because they really help fight against cancer. But one thing that if you're on chemo, I usually ask patients to take ice chips or even cold drinks. So I mentioned kanina the cryotherapy in the hands and feet, like holding the ice. But drinking the drinking, let's say, a cold drink, fruit slush, will help decrease the mouth sores from the chemotherapy as well.
Yeah.
Since there's also vasoconstriction in your mouth, so that's very good to do while doing your chemotherapy.
Yeah, because I remember my dad, when he was undergoing chemotherapy, would give him ice chips just to relieve the dryness in the mouth. Yeah,
that
so
helped.
Doc, let's talk about this upcoming talk that you're having on March 22, and this is aimed to help women of all ages take better care of their health and feminine areas. What can you tell us, or can you tell us more about this?
Yes, so thank you for letting me share that. But last note for cancer patients, if you have skin rash, please do consult a board-certified dermatologist. Bring us into your team because I'm sure that more people who will be able to help you you will be able to have more hope in pursuing your treatments. And this coming March 22, I have a free webinar with Dr. Amy Kua on lumps, curves, and women's health. This is open for all women. You know, we want to teach you how to take care of your feminine areas. That's your breasts and your feminine curves. So I hope you can text or send a message in Facebook Messenger at Skincare for Hope or at Skincare for Hope Advocates. So we'll send you the Zoom link as soon as you text us.
Doc, sorry, I just want to ask you more about your advocacy. Of course, it's very special what you're doing, and of course, making it free as well to let people know more about it. Do you feel that it isn't talked about enough, or maybe the information out there is maybe not as accurate as it should be? That's the reason why you're doing webinars like this, trying to get information out there properly?
Yes, it's actually just recent, like for the past decade, that cancer patients are thought of in the dermatology or skincare or realm. It's often put off. But you see, when you take care of yourself, you take care of your skin, when you see those rashes resolving, it gives you more hope to continue. And especially now that the medications, the newer ones, are really very good for cancer. But at the same time, their skin side effects are very severe. So I'm really trying to advocate to put the dermatologist into your cancer team because I'm sure we will be able to help you, not just with your skin rash, but increase your hope in finishing that cancer journey.
Doc, do you feel that it actually, you mentioned helping you finish the cancer journey. Do you feel that it actually helps with the mentality going through this? Because I am 100% sure that anyone going through the battle against cancer could use every bit of boost, every bit of help, especially from the psychological side of things, dealing with this type of affliction and this ailment.
Yes, that is so true. Because if you stay beautiful in the outside, you find more hope. Now, promoting, sorry, my book, Staying Beautiful and Hopeful for a skincare guide for cancer patients. This is available in Lazada and Shopee. This is really for to boost more hope for cancer patients, not just to take care of their skin. So I hope you get to see that.
Now,
For
Doc,
cancer
before
patients.
we let you go, for those who have more questions and want to reach out to you, where can they find you?
Yes, so I have online consultation. So I'm found in Sirius MD. And also you can find my Facebook page, Claire Habito, Claire Habito Dermatology MD. And I work in Asian Cancer Institute and Healthway Cancer Center.
Awesome. Well, thank you so much for joining us today, for the great advocacy that you are doing. Doc, we really appreciate it.
Thank you.
Thank you so much, Doc Claire Habito.